My name is Dr. Audrey Cook. I'm a board-certified internist with a passion for endocrinology. I'm a member of the internal medicine team here at Texas A&M. I've been involved in the hypophysectomy program because of my interest in endocrine diseases, and so I'm there to offer some advice and guidance as far as patient selection, preoperative screening, and then part of the post-op care. So we are really very excited to be starting a hypophysectomy program here at Texas A&M. Essentially what we're able to do with this procedure is provide a definitive cure, not just ongoing treatment, for dogs with hyperadrenocorticism, so classic Cushing's disease, or cats with acromegaly, hypersomatotropism. So rather than struggling to manage these patients, we can actually now cure them by removing the underlying problem, which lies deep within that pituitary gland. Presently, very few places, I think merely a handful, offer hypophysectomy across the US. We are geographically very well positioned to be able to service an enormous number of people. Hypophysectomy is a complex procedure, and I think step one is having a phenomenal team of people. And so we're very fortunate to have all of that at Texas A&M. I would say, though, the most important part of all this is the person actually doing the neurosurgery. And we have Dr. Ito. He's an internationally renowned neurosurgeon with potentially more experience than just about anybody else in performing neurosurgery in dogs. And so we're starting with a real ace from that perspective. We are really happy to discuss suitability with a vet. If they identify a dog with Cushing's disease and the client is up for a hypophysectomy, I would really urge them to just reach out, and we're happy to chat about how that dog is doing and see if we think it is a good candidate.
My name is Nick Jeffrey, and I'm one of the professors in neurology and neurosurgery at Texas A&M. The problem that we have with treating epilepsy in dogs is that many use 3 or even 4 medications, but some animals still carry on having an unacceptable number of seizures or an unacceptable severity of seizures. The corpus callosotomy is a procedure where we cut the corpus callosum, and the purpose of cutting that is to stop epileptic seizures from generalising from one part of the brain to the other, so that we can restrict the impact on the animal of the seizure. It's been introduced slowly into clinical practice in Japan, and we're very fortunate to have Daisuke Ito, a very experienced neurosurgeon who does a lot of intracranial surgery. Between us, we can introduce this into our vet school, which is probably one of the only places in the United States where we can do this.
My name is Ashley Self. I am the Assistant Director of Veterinary Nutrition here through the GI Lab. I'm a licensed veterinary technician with a specialty in nutrition, and we're working to start a veterinary nutrition service. Our nutrition service is a referral-only service. We have a unique opportunity in that you can select to do direct-to-vet recommendations with us, or we can work directly with your client and provide direct-to-owner nutrition recommendations. While there are a lot of cases that could benefit from working with a nutritionist, right now our veterinary nutrition service is prioritizing GI and critical care cases. So if your patient falls into either one of those categories, we will happily consult with you or the owner. If it's anything outside of GI or critical care right now, it's not something that we're seeing, but hopefully we will expand to other diseases in the future. I think a veterinary nutrition service could be really impactful to not only directly benefit the patient, but also to provide support to the veterinary healthcare team. A lot of times if you start to adapt the 5th vital assessment, or every patient every time, in doing a nutrition assessment, you'll probably find that you or the owner has a lot of nutrition related questions. So our hope is that we can be here to help directly relay some of that to the owner, or to help you as the veterinary team decide what the best nutrition step is.